The role of HPV in head and neck cancer is becoming a very important one. As you know, the major risk factors for head and neck cancer are smoking and alcohol in particular, and that remains the same, I would say, in the last years. But we have seen that in the Western world, in particular, HPV as a risk factor for developing oropharynx cancer is increasingly being seen. It's also in other parts of the world, but in fact, if you look in the United States and in Sweden, the viral associated oropharynx cancers are over 80%, I would think. And in different other parts of the world, the incidence is lower. In several countries, it's variable. Most of the time, somewhere between 20 and 35%. But you have the impression that overall it is increasing. So it means it's becoming an important topic. And the point is that these tumors, the patients that are suffering from HPV-associated tumors are different from the patients that are having tumors that are tobacco and alcohol related. In general, they're somewhat younger. You see that very frequently they have a small primary disease with bulky nodes in the neck. And the prognosis of these tumors is somewhat better, and that is irrespective of the treatment that we are giving. So it's a prognostic factor. So HPV positive tumors in general are doing better than HPV negative tumors. And you can ask the question then, does it have implications for our treatment? Does it mean that we can treat these patients differently? And the answer is, for the moment, no. At this moment, we treat the patients with HPV positive tumors in the same way as with HPV negative tumors. So, but we have some indications that perhaps they might be treated in the future less intensive than what we do now. And one of the papers that was reported here also was an update of a study that was performed in the United States. And they were looking for what the role of induction chemotherapy was. So they were treating the patients with induction chemotherapy, and if these patients were responding very well, had a nearly complete response, then these patients had a lower dose of radiation afterwards. And the patients who did not respond very well, they got the full dose of radiation. And the outcome was, in fact, very good for the group that had a lower dose of radiation, and also it seems to be that the toxicity was indeed less for the patient. And that is a very important message, because one of the problems that we see in our treatments in head and neck cancer is the toxicity when we give patients radiation with or without chemotherapy. And in particular, the late toxicity is a major issue. So if it is possible to have a de-escalation of the radiation, it would be beneficial for the patient. So that looks promising, I must say. Looks promising. Well, anything new? I would say no, not anything new. I think that we have seen in the last couple of years that the role of induction chemotherapy has been explored in several randomized trials, and most of them are negative, unfortunately. Here at the meeting, there was a report of a meta-analysis on the role of induction chemotherapy, where they looked for several studies, and they pooled these data. As far as I remember, it is a literature meta-analysis and not a patient individual patient-based meta-analysis. So the value of that is somewhat less than the individual patient-based analysis. But it showed that there was no benefit of adding induction chemotherapy to the local regional treatment. And so we mostly indeed say in conferences that this is a fact. That doesn't mean that induction chemotherapy is not important. It is important. It is important for some specific patients, patients with huge tumors where you want to rapidly reduce the tumor in size. It's also an important way of having larynx preservation procedures. It's already known since the 1980s that this is an adequate approach. So induction chemotherapy for sparing the larynx and not doing a total laryngectomy and in patients that are responding to the chemotherapy, they can be treated with radiation, and thereby you can avoid that patients will be treated with total laryngectomy, by which they lose the larynx. So that's a fact. Now the point, of course, is how do we go further? Did we use the optimal form of induction chemotherapy? Nowadays, the standard induction chemotherapy is with the so-called TPF regimen, but there may be other regimens that we can test that may be as good as the TPF regimen, but are less toxic. And I think that this is one of the future studies that we plan to do to see whether we can reduce the toxicity of induction chemotherapy. I have attended the poster discussion session, and on Monday we will have the oral session, so we have to wait what's going to be presented, the details of the presentations. But what I thought was very interesting is the fact that now, after so many years, we are really looking to some very important questions that have not been answered for a long time. And so, for instance, without adequate data, we have changed practice in concurrent chemoradiotherapy, where the high dose cisplatin, 100 milligram per meter squared, given every 3 weeks, 3 times during radiation, is being replaced in many centers by using a weekly regimen, with the hope that it would be less toxic. And of course it's more practical because you can treat these patients on an outpatient setting, while with the high dose cisplatin that's a little bit more difficult. So I understand it, but the question is this really as good as the high dose? And now during this ESCO meeting, there are more and more people that are looking at this topic now. And there are some indications from the presentations that I heard that we must be very careful not to change the practice that we had. There are some suggestions that the weekly regimen might be not completely the same in efficacy as the 100 milligram. And therefore I think that doing prospective trials comparing these two approaches is very important. And unfortunately, there are some studies ongoing. There is a study ongoing in Japan. There is a study ongoing in India. And I think that these trials are very, very important for us, the outcome of that. And I would really think that unless a patient is absolutely in a condition that the patient cannot tolerate high-dose chemotherapy with cisplatin. Otherwise, I would say stick to the standard way of giving it. So, and it was interesting to see that there is more attention now after so many years. I also saw a paper where, for instance, the role of cisplatin versus carboplatin was compared. And again, there was a suggestion from that paper that the use of cisplatin was better than with carboplatin. And again, because there's a tendency to replace cisplatin by carboplatin because it's less toxic. And I think, again, you have to be careful not to change the standard of care without prospective randomized trials. And I think that was interesting to see at this meeting. Now, another point that you asked what was fascinating, well, in this meeting, everything that fascinates us is immunotherapy, and the checkpoint inhibitors are also for head and neck cancer playing an important role. On Monday, we will hear an update of a study that was presented last year by Dr. Seward. And I hope that the data that will be presented there will confirm what was presented a year ago. And that showed, in fact, that the checkpoint inhibitors, as it was used, are beneficial for patients. They have a response rate of about 20% in patients with recurrent metastatic disease. And it seems to be both active in patients with HPV-positive tumors and HPV-negative tumors. So it looks quite promising. What I think also, I did not attend the presentation, but I think that nivolumab was also tested in lung cancer in the second-line treatment. And it's very interesting to see that now also for the patients that don't have mutations, where we have a specific treatment for, that now these immunotherapies are also important for patients with lung cancer, with non-small cell lung cancer, who don't have a mutation. And we never had really something good. And there has been a report now that in comparison to chemotherapy, this drug was giving better results. Changing practice, very important.